Peace, love, and light, you guys. It's me, Miss Bobby, and I am here with another update. So I believe the last information I gave y'all was Friday. I was on my way to my pre-op appointment with my surgeon and was hoping that all went well and that it didn't take forever. And my prayers and the universe heard me were answered because it was a pretty smooth appointment. I was in and out in maybe a little over an hour from the time they called me back. It was beautiful. So just go ahead and jump off with saying, as of my pre-op appointment with my surgeon, I was 307. That was with, I was completely dressed with no shoes on, 307. And today is Sunday. I will start my pre-op diet this coming Friday. I'm headed out in just a little bit to get some of the stuff that I need for my pre-op diet, as well as all of the fluids and puree that I would need after surgery. So basically, the pre-op appointment is just to make sure that they have all my information in the computer correctly, as far as like my age, my weight, my height, the medications that I'm taking, the stuff that I need to stop taking, make sure I have the right procedure down for him to do. You don't want to go in and get one surgery and then you come out and they gave you something else. So, and then questions that we may have, as well as them giving us information verbally as well as in a package. So I'm going to give y'all some of the questions that me and my wife had at our at this pre-op appointment, in case anyone is thinking about it. And these are some questions that, you know, you may, typical stuff that you want to know anyway, but because you're so nervous, you may forget. So one of the first things I asked was, how long does my procedure, and I'm looking off to my notes, how long does my particular procedure last? By the way, I'm getting the gastro bypass, yeah. And it could take anywhere from 2 to 4 hours. From the time my wife will see me again, though, it will be somewhere between 6 to 8 hours, because I will get to a certain point and, you know, we will do our little hugs and kisses and goodbyes, and then I have to get prepped and ready to go into the surgery room. And then there's another set of prep and ready before they put me under, and then they put me under, and then there's a wait time, and then the surgery will start. At the end of the surgery, I will go into, of course, you know, up under anesthesia care. They have to wait for me to come out of it, make sure all is good and well. And that's a process. And then I will be put into a room where my wife can then be reunited with me. So again, the procedure could take anywhere from 2 to 4 hours. And from the time she will see me again, could be anywhere from 6 to 8 hours. They will take all her information down the day of surgery. She does get updates during surgery and when surgery is over. My next question was body piercings. Do they have to come out, or can I put plastic retainers in? And the answer to that question with my doctor was, I can use plastic jewelry. Just nothing that's steel, titanium, nothing like that. I said, what is my mobility right after surgery? Like, what is it that I can and can't do? And they promote walking immediately. And so even the day after surgery, walk. The days after surgery, walk. He says, don't really talk about exercise and what I can do until I come to that 1 week post-op appointment, and then we'll see where I'm at after those 7 days of surgery. He says, but we'll always ease you into at least 30 minutes of moving a day, at least 3 times a week. So that was that. And then we talked about, my wife had a lot of good questions and she took notes. So one of the things were, like I said, 30-minute sessions, 3 times a week. When I start to work out a little bit more intensely, which is somewhere between 4 to 6 weeks after surgery, they want my heart rate over 160. That's how you know you're getting a good workout. I will have 6 small incisions. I'll do my best to try to show you. Breasts, ribs. My incisions will be 2, 4, 6. 2, 4, 6, right across. And he said that when, you know, they check you lay flat, he was like, I actually feel your ribs pretty good. So that's a good thing. The incisions won't be too hard. There's not any major issues that's going to be here because I can feel your ribs. So that was a good thing. He says a lot of people have this misunderstanding about their incisions and wanting to keep them covered up and safe. He says it's a wound. You want it to naturally air out and heal itself. So they will put little scripts on it, leaving the hospital. A week from there, I need to take those scripts off. And I don't need to cover them up. I don't need to cover my incisions up. In fact, he said the little spaghetti scraps that I wear, he said this may be even a little too clingy. You don't want anything clinging to your incisions. You want it loose and flowing for the time being while they're healing. I am to stop all medicine the day of surgery. I don't take any medicine the day of surgery. For those of y'all who don't know, I'm a type 2 diabetic. I do take metformin. I will stop taking metformin 3 days before my surgery. They would like a list of all medicine, and the easy way to go is to line it all up with the name and the dose sitting in the front. Take a picture of it, pass it off to the doctor. They love that. It's good. It's right there on the chart. They can see it. Mucinex, and I'm probably saying that wrong, Miralax is going to be my new best friend. And with that being said, nobody really has a bowel movement the first few days after the procedure, but you don't want to go too long. So yeah. And the good thing about the Miralax is it has no taste. You can add it into almost anything, and it doesn't really have a max regimen. So you can add it as you feel you need it until it starts to move you and you realize what regimen works for you. So yeah. My wife asked about deodorant, and he was like, yeah, you can put deodorant on. We're not worried about you being musty though. Like, and I'm like, okay. But yeah, I can wear deodorant the day of surgery. Comfortable shoes, because they're gonna get me up and walking, and with me having the foot and ankle issue, I'm gonna make sure that I have my arch support slides, because I can't walk barefooted and I can't really wear flat-footed shoes for too long because it will cause unnecessary pain. So I think that was about it. We asked because my period tracker says that my cycle is due to start the day after surgery. Is that an issue? It is not. It's not going to cause any problem at all. What else? I do have, in all my almost 40 years, last year I had an issue with piercings that flared up and turned into keloids. I don't have them anywhere else. I don't have any other issues. But they said that even though I now may be considered risk for keloid skin, hence I'm getting the incisions, that doesn't stop the surgeon. That doesn't give them any like red flags to not do anything. It just means that I need to pay close attention to my incisions. And if I start to have any of that issue, then you will see a different doctor for that later. Because again, that's not anything that the weight loss surgeon would be concerned about. And there's nothing that they can do differently so your skin doesn't keloid. Because if anybody knows, basically what happens with your skin being, open to keloids is basically it's a tear or incision in your skin that is trying to heal, and it doesn't. It overlaps and bubbles up. That's a keloid. I hope that I gave a good description. If I didn't, please don't come for me. But that's just how I was explained what a keloid was, where your skin does not heal back together properly. I do believe that's everything. You do kind of get a little mix between what your doctor says you need to do and what the nurses are wanting you to do. And hence, I'm going to listen to my doctor overall because, I just feel like that's just kind of the way to go. And what it is the nurses have a guideline. Everybody has put together a bulletin, a guideline that they want you to follow, which is, for instance, I need to every 15 minutes take a few sips of fluid. Whereas my doctor was like, really, if you're able to, I would rather you take a sip or two every 5 minutes. And if you can't get your protein in, that's fine. I'm more concerned in the first week or two about you not being dehydrated versus you just trying to get protein in, which means if I can't get the protein shakes in, at least get some water in. So yeah, I'm going to wrap this video up because it's approaching 10 minutes, but I just wanted to give everybody an update. My pre-op appointment with my surgeon went well. Right now I'm 307. I will start my pre-op diet this upcoming Friday on the 10th. It is about to go down. And my surgery is February the 24th, and it is here. Please keep me in your prayers. Pray for me. Send good, positive energy and healing vibes my way. Peace, love, and light. I love y'all.